Not very. This is one of the highest bonds they've ever asked for in this district. It's about $8.8 million more than what the magistrate in this case originally set the bond for. But the feds continue to say that Dr. Fata is a wealthy man with vast resources at his disposal who could easily flee the country.
The battle over bond continues. Dr. Farid Fata is still locked up, and federal prosecutors are trying to keep him in custody. Now the assistant U.S. attorneys who have charged Dr. Fata with health care fraud are saying the wealthy 48-year-old needs to post a $9 million bond before he can return to his upscale Oakland Township house. The FBI raided Dr. Fata's home and offices last Tuesday. He was arrested, accused of giving chemo and other treatments to cancer patients unnecessarily so he could cash in on Medicare billings.
I was pounding the table last year when I stopped the chemo. I says, God, if anybody is going to this man, get away from him, get away from him. He doesn't tell the truth.
Last week, a federal magistrate set bond at $170,000. Now the federal prosecutors say they have uncovered $9.4 million in assets the FBI has not seized yet. That includes money from untraced assets in Fata's own financial management company's report, other assets FBI agents have traced but haven't yet seized, and assets available to Dr. Fata's wife, who is the CFO of Michigan Hematology Oncology.
There will be a hearing tomorrow morning on both this issue of bond and another issue. If Dr. Fata does put up some money for bond, federal prosecutors are asking him to prove that he did not use fraud to get that money. Now, meanwhile, Fata's attorney has been arguing that he does not have access to that much cash. He says Fata and his wife can actually only draw upon $70,000 in cash for the bond.